All right, Chairman, the floor is yours.
Thank you, Dr. Townsend Smith. We are back in session, and Dr. Townsend Smith, I want to confirm that we have a quorum.
Yes, sir, we still have a quorum.
Okay, thank you. We'll now proceed to our Strategic Planning Committee, and I'll turn to the chair of that committee, Mr. Ford. Mr. Ford.
Thank you, Mr. Chair. I am James E. Ford, the co-chair of the Strategic Planning Committee. I'm joined by my vice chair, Ms. Jill Kamitz. Before we proceed with a update on where we are, just as a moment of sort of recapping, you all are aware that we have spent time working on the implementation moving forward of our 2020-2025 strategic planning goals and objectives. Goal 1 is to eliminate opportunity gaps by 2025. Goal 2 is to improve school and district performance by 2025. And Goal 3 is to increase educator preparedness to meet the needs of every student by 2025. Before we get into ultimately our presentation, I'd like to ask Dr. Townsend Smith if she could provide an update on some of our progress thus far. Dr. Townsend Smith?
Yes, sir. Good morning. Well, it's no longer morning. Good afternoon, Chairman Davis, Superintendent Johnson, Lieutenant Governor, and other respective members of the board. I want to stand before you today, but before I begin, I think I would be remiss without saying thank you to the chairman and the respective board members, advisors, and colleagues for your leadership today, and just for showing up, because that's so very important at this critical point to confront these important issues. And while words escape me, and many of you know I'm not shy with words, but words escape me today, I just wanted to highlight that piece at the top of this meeting. I am humbled because over 2 years ago, you allowed me to take this role and to help shape your priorities and initiatives. Never would I have imagined the impact of our discussions and decisions. You have showed up, which gives me the courage and the strength to show up even during this most difficult time. And I continue to be proud to lead with you in this work. So the purpose, as Mr. Ford stated this morning, a few minutes ago, is to review the progress and next steps with our plan, follow up with any questions. While we have not been before you since January, which I believe was the last time we met, as we were supposed to deliver a full slate of partnership presentations to you at our May meeting, which we lost that opportunity, but we have continued to do the work behind the scenes. During this time, we have continued to seek out philanthropic and grant funding, and I am pleased to report to you today that we have secured 4 major buckets of funding to support this work. With the help of Dr. Daniel Allen, we have secured a grant totaling over $135,000 to help with certain initiatives. Z. Smith Reynolds has granted us $95,000 to do the work. We got an extension with our Vanderbilt grant, upwards of $600,000 to continue the work. And we, in the coming weeks, we will be applying for some additional funding to help address some of the school mental health issues that Mr. McKinney outlined this morning in his presentation. So as we continue to go about this work, we're going to operationalize this plan. Mr. Ford will probably outline a framework of action as we continue to draft that out. But partnerships matter. That was highlighted so eloquently this morning in your comments and just through the Leandro report that we have been studying over the last couple of months. So partnerships matter. We're going to continue this thing through the next few months to maximize on the time that we lost in our planning and working session. So that's a brief update to highlight for you some significant achievements I feel that will help support our work as we move forward. We have we will need continued funding, and so we will continue to seek out those opportunities to ensure that we maximize on everything that we need to accomplish in our strategic plan. Thank you, Mr. Ford.
Thank you, Dr. Townsend Smith. And before we proceed, are there any questions or reactions to Dr. Townsend Smith's opening comments or presentation? Hearing none, I'm going to go ahead and proceed. And in the interest of talking about our various partnerships, we are delighted to have with us from NC Child, Whitney Tucker, the Acting Policy Director, who's going to talk about the state of North Carolina's children. As you all know, part of our approach is founded on this notion of equity and of whole child. And so we thought it apropos to allow Whitney to provide for us a full picture of what the state of our children is. In African villages, there are some greetings in Southern Africa where they ask in their language, essentially, how are the children? And so I hope to be able to answer that question via this presentation. So Ms. Tucker, you can feel free to proceed.
Thank you so much for having me this morning. Can everyone hear me all right?
Yes, ma'am, we're hearing you fine.
Fantastic. So if possible, I want to share my content via PowerPoint. And I think everyone should be able to see these slides now. Is that correct?
Yes, ma'am, we see it.
Fantastic. All right. So again, my name is Whitney Tucker, and I manage the direct advocacy work at NC Child. We produce the Child Health Report Card in partnership with North Carolina Institute of Medicine, and also county level data cards, which have just recently been released for 2020 and that you can find on our website at ncchild.org. So just quickly about NC Child, for those of you who are unfamiliar with our work. We are a statewide nonprofit, nonpartisan advocacy organization that works to advance public policies in the interest of all children and their families so that North Carolina's kids can reach their full potential. We work across a variety of issue areas since children's well-being doesn't fit neatly into one space or another. And that really allows us to advocate for families flexibly as different needs arise. So while I know that you all are focused on education, it is clear to me from the comments that have been made already today in this meeting and from your other presentations that you understand the interconnectedness of children and family circumstances with children's education. And so I'm going to show a few different data points to give you a more holistic view of what's going on with our state's kids. NC Child uses all of the methods that you see here on the screen to accomplish our goals. And so this work today is just sort of a little peek into the research and data analysis. But I want to say that if you see something today that is interesting to you or that you'd like to know more about, please feel free to reach out to me and I will be happy to try and find you additional data. All right, now jumping right in, I wanted to start with a slide of general demographics to give you a frame for how many children that we're talking about as I move through the rest of the data that I'm showcasing today. The population figures that you see here are for 2018 because that's the data year for most of the indicators from this year's county data cards because of the time that it takes to collect data and clean it and then have it re-reported. So our data comes from a variety of different sources, and I've included source links at the bottom of every page of this presentation. But there's also a data notes and sources document that comes along with our county cards on our website if you're interested in looking at the circumstances more specific to a single county. So the child population in the state is growing slowly from about 2.2 million in 2010 to 2.3 million in 2017, and for reference, just about 2.4 million today. Worth noting is the fact that nearly half of all children in the state are in the most critical stage of development from ages 0 through 8. Approximate racial demographics are in the chart that you see here. The majority of our children identify as non-Hispanic white, nearly 1/4 as non-Hispanic Black, almost 1 in 5 as Hispanic or Latinx, 3% as Asian or Pacific Islander, 1% as American Indian, and 6% as some other race. In terms of population trends, The fastest growing population of children in the state are Hispanic Latinx children. And from 2010 to 2016, the U.S. Census Bureau estimates that North Carolina's Hispanic population of all ages grew by 132,000 new residents, which represented a 16.5% increase for that demographic group. Data from Carolina Demography showed that the majority of our state's Hispanic and Latinx children are born to North Carolina resident parents or to U.S. born parents who migrated to North Carolina from other states. So something about what we're doing in our state is appealing to Hispanic and Latinx families, and they're wanting to really grow roots here. Contrary to narratives that are often shared and are largely xenophobic, the population of foreign-born Latinx residents has actually not grown in North Carolina since 2010. So to ground our conversation, now that you have an idea of who the children are and their demographic backgrounds, I wanted to start with just a quick overview of some basic points that we know to be true based on the available research and data that is here in North Carolina and from all of our great research institutions here, but also from national partners and research groups. So first, I'm sure that being in the education field that most of you have likely heard and are familiar with the concept of ACEs, or Adverse Childhood Experiences. But simply defined, adverse childhood experiences, or ACEs, are potentially traumatic events that occur before a child turns 18 years old. They can include things like experiencing violence or various forms of abuse or neglect within the home, growing up with a parent who is incarcerated, and having a family member attempt or die by suicide. ACE exposure as children has been linked to a host of negative health and education outcomes in adulthood, including things like cancer, diabetes, drug and alcohol abuse, decreased test scores, depression, anxiety, and early death. To help protect against the impact of ACEs, children need early, consistent, and high-quality supports, both within and outside of school, that can promote and maintain their developmental gains. And so I want to start by talking about poverty because it is essentially the umbrella that a lot of other dangerous outcomes for kids really fall under, and an indicator that if we're able to make some significant progress in improving for children in our state, will have a large impact on a number of different outcomes. So research clearly tells us here that improving children's health and well-being will require the state to ensure economic development, safe housing, and other policies that support healthy families, because children's well-being is influenced by where they live, play, and learn. Children living in families that cannot afford the basics in life often have reduced access to safe living conditions, healthy food, and opportunities for exercise, all of which increase their risk for poor health and, relatedly, poor educational outcomes. I've listed here on the slide from our county cards this year, the counties with the highest and lowest rates of children living in poor and low-income homes. And I'm going to explain that indicator a little bit more on this next slide. So when we talk about families that can't afford the basics, we're really talking about a lot of North Carolina families. 44% of children in the state live at households at or below 200% of the federal poverty line, which is that poor or low-income threshold that I mentioned. And there are really significant disparities by race. These are 2018 figures, and based on the 2018 federal guidelines, 200% of the federal poverty level equated to $41,560 in annual income for a family of 3. I'll note that while 100% of the federal poverty level is generally referenced as in poverty by a lot of different sources, that federal poverty level uses food costs from 1962 to estimate basic income levels for families of various sizes. The same standard from the 1960s is still in use today and only updated for price changes using the Consumer Price Index. Because of that, many researchers in the child advocacy sphere now suggest that most families require an income approximately twice the federal poverty level to meet basic needs that we have these days, such as transportation, child care, health care, and reasonable accommodations and housing. And so as you can see, while an unacceptable percentage of our children really live in families that are struggling to meet those basic needs, 44%. The disparity by race is really astounding, with 29% of white children well below that state average living in these conditions, with 68% of Hispanic and Latinx children living under these conditions, and 61% of Black children. It's important when we're talking about poverty that we remember and understand that it impacts children beyond just their family's ability to buy goods like food and clothing. Because our society so strongly links the ability to pay with access to quality environments, whether those be learning environments, safe housing in neighborhoods, or healthcare institutions, research shows that children living in poverty are more likely than their peers to be exposed to events that harm healthy brain development and can limit their opportunities across the life course. Generally speaking, poverty in our state tracks closely with race, age, and geography. So children of color, children under age 6, and children in rural communities are overall most likely to live in poor and low-income homes. Historic policy barriers to family financial security and economic mobility have resulted in child poverty rates that give us disproportionately negative outcomes for Black and Latinx children. 29% of white children, as I mentioned before, live in poor and low-income homes statewide, compared to, again, that's 68% of Latinx children. Young children are more likely than older children to live below the poverty level, and this is largely due to the fact that young children are more often being born to young parents who are less financially established than older parents. In 2016, nearly 1 in 4 children ages 0 through 5 lived in poverty in North Carolina, compared to 1 in 5 older children in the state. And then finally, families in rural communities are more likely than those in urban counties to live in poverty because higher paying, more highly skilled jobs are often found in urban centers compared to the availability of work in rural areas. Now, with that said, widespread job losses have meant that families, more families, are now sliding into this high-risk category for kids. And that's concerning for 2 different reasons. So, the first being that we already had way too many children living in families without enough to meet basic needs. And the second being this cascade of traumatic events for kids that are more likely to occur when they live in families struggling with poverty. So things like everything that you see here on the screen. Research has linked all of these outcomes with the experience of poverty in childhood. These outcomes are also all more likely when a child or their family doesn't have protective factors like strong social connections, caregiver resilience, and concrete supports like cash benefits and food benefits and subsidized services when they need those. Without those influences, the effects of poverty are particularly salient for young children with developing brains, and those effects can last a lifetime. Now, moving on a little bit, the toxic stress of poverty on caregivers is also associated with a heightened risk of abuse and neglect for children. And we showcased some of this data in last year's Child Health Report Card. This is certainly going to be exacerbated by the COVID-19 pandemic. Overall, we have seen fewer children statewide investigated for abuse and neglect, but there is, reason to note that this figure is really neither positive or negative because fewer investigations doesn't necessarily point to lower rates of abuse. An investigation does not actually indicate a substantiated claim of maltreatment, and most cases of child maltreatment statewide are for neglect, which often occurs as a result of family economic circumstances rather than, physical abuse of children, which is what a lot of people associate with child abuse and neglect. Things like not being able to afford to pay your light bill can eventually lead to a child being reported for neglect if there's no power on in their house, right? We also see a consistent disparity by race here that's important to monitor. While white children are investigated at a rate approximately equal to their proportion of the child population, and Hispanic and Latinx children are investigated at rates lower than their proportion of the child population, American Indian children account for 1% of North Carolina's child population, but 2% of investigations of child abuse and neglect, and Black children account for 23% of the overall child population, but 35% of investigations for maltreatment. When we talk about children's well-being in the context of the security of their homes and their neighborhoods, it's important to remember that you can't separate social, political, and economic influences from family outcomes because they show up in things like investigation rates here, which don't necessarily show the patterns by which children are experiencing abuse and neglect, but they do show which families are most often suspected and investigated for it. Race is a strong factor in family over-policing in the same way that it is for individuals and for neighborhoods. So for reference, in fiscal year 2018, about 5% of the investigations for child maltreatment statewide were substantiated. And of those, 56% of substantiated cases were for white children, 30% for Black children, 3% for American Indian children, and 11% were of some other race. Worth noting is that we're already hearing right now at NC Child that there are fewer reports of child abuse and neglect during this pandemic. And while, again, that may sound like good news, it's actually just an indicator of how little contact children are having with adults outside of their households. Fewer mandated reporters seeing children due to COVID-19 means that there are fewer caring adults in their lives who can spot any potential signs of abuse or neglect. A decrease in assessments does not necessarily mean that children are safer, and this is really going to be an indicator that you'll want to keep an eye on. Now, speaking of child maltreatment and other adverse childhood experiences, those are more likely to occur when communities are struggling with systemic inequities, and there's a strong relationship between adversity in a family and adversity in a community. We see that really clearly when it comes to social mobility for children. Right now, only 1 in 3 children born into one of North Carolina's families at the poverty level manages to become an adult with middle or upper level income. Upward mobility is poor in both rural and urban areas of North Carolina, as it is in most of the Southeast, which you can see on the map here from the national research of Raj Chetty and his colleagues at Opportunity Insights, which is based at Harvard. While children in higher income households tend to not be impacted by location, though, research has found that geography has a very strong influence on whether a child growing up in poverty will ever move up the income ladder. This is because the markers of economic mobility change at each local level, down even to the neighborhood. And I've listed those markers here for you on this slide. Note that one of these is low quality schools, but as I mentioned before, we can't really separate something like school quality from a different indicator like income inequality or racial segregation, because the way that our policies have been passed historically and the way that they're often upheld means that changing one of those things and making schools more highly racially segregated means that we also tend to see lower quality schools in areas where there are more racial and ethnic minorities, or areas where there are a higher proportion of low income residents, right? All of those things go hand in hand. And in order to ensure that children are able to have more economic opportunity and more social mobility as adults, we're going to need to address all of these things at once. I also want to note before I move on that single parent households has been associated with low economic mobility, but every research study that talks about this does note that that is not because single parents are somehow less capable of raising really capable and talented children, but more so because single parent households simply have fewer resources than dual parent households to put toward child rearing. So more money to go toward things like high quality education or experiences outside of school. Dual parent households have more time to put into a lot of the things that children need, right? And single parent households often have a single earner who is simply spread really thin between working to afford the needs of children in the household and actually being able to be there physically, spending time with those children versus working to afford them. So moving on to food security. Food insecurity is a determination of the USDA that's measured by a lack of access at times to enough food for an active, healthy life for all household members, and related to the limited or uncertain availability of nutritionally adequate foods. The metric is based on responses to the National Food Security Survey that's conducted by the USDA about the access to and the quality of food available in each household. Quality is an important component here because in North Carolina, nearly 1 in 3 kids between the ages of 10 to 17 are overweight or obese, which has as much to do with the nutritional value of food consumed as it does with fitness and activity levels. So at its most basic, food security can be defined as I've put it here on the slide. Consistent access to enough food for everyone in a home to live a healthy, active life. This again is different from hunger, which measures personal discomfort due to food shortage. That said, the terms are often used really interchangeably because the practical difference between having an insecure amount or quality of food and your personal discomfort due to that food shortage is basically non-existent. So I put here the counties with the highest and lowest rates of child food insecurity as of the 2019 data available from Map the Meal Gap. This metric, again, is based on a national food security survey by the USDA. But after a glimpse at the state's income disparity, it's unsurprising that food security continues to be a challenge statewide. The scope is incredibly large. 1 in 5, or 461,630 of North Carolina's children lived in households that were food insecure at some point in 2018. I think it's also worth noting that even in counties with modest rates of food insecurity, there may still be a large population of children whose families are food insecure. As you can see, the counties with the highest rates of food insecurity before COVID hit are all located in eastern North Carolina, with nearly 3 in 10 children experiencing this particular hardship. For reference, the US average for this data year, 2018, is 15%. And the statewide average here in North Carolina is 19%. Now, to some directly related education indicators. I know that you all deal with K-12, but I have pointed out a lot around early education, and I'm going to talk a little bit more about why that is. But to start, just what we know is that this is really pretty self-explanatory, but there are decades of research that point to the importance of investments in all of these different areas of child early education and K-12 education to later success as adults, right? And so I'm going to talk more about education first, and then move on to a little bit more about mental and behavioral health. But all of these things combined are what's needed to create an environment where there are healthier kids and more stable families. So starting off, I'll talk about, just kids who are even in school at all, right? So low reading achievement is really understood in the context of early learning accessibility. And that's the main reason why I really want to talk a lot about that indicator today, because we often see those systems as really disparate, when I think that all of you who work in education know that the earlier kids are able to get a start with quality learning, the easier it is for them to go through our K-12 education system and to really succeed. Right now, fewer than half of all 3 and 4-year-olds in North Carolina are reported by their parents to be enrolled in any sort of school. That's approximately 247,000 children. For reference, the national average here is 48% enrollment, but racial disparities are important to keep in mind here as well. High quality early care and education is a factor that research has been pointing to for decades now to say is really the strongest indicator that we have of 3rd grade reading achievement in particular. And so if we are able to close gaps here, we will be able to more easily close gaps in 3rd grade and also with 8th grade math. That's going to be a challenge though, because of the just incredible cost of childcare. I think that everyone with children doesn't really need to be told this, but I think that looking at the data can really explain, again, why we see the disparities in enrollment from the previous slide. While each family's choice to enroll their 3 or 4-year-old in any form of childcare and early education is based on a number of personal factors, cost definitely plays a role in access here, and it's important to contextualize the data, especially in light of COVID-19. Childcare is currently unaffordable for most families in North Carolina based on the federal standard, which I've put here on the slide. And it's a particular burden when you view North Carolina's wide racial income gap. The U.S. Department of Health and Human Services defines childcare to be affordable if it costs families no more than 7% of their income. So for perspective, I have noted the average cost of care on this slide for a single year of infant care in North Carolina, and then also for a single year of care for an infant and a 4-year-old sibling, which nears 50% of income for many households. The high cost of childcare is a multi-factor issue. Costs have risen exponentially for parents who are paying privately. Parents using subsidy funding to pay often find the level too low to afford high quality care. Teachers are vastly underpaid for the value of their work, causing high turnover and burnout. And providers gain so little profit compared to the cost of running a high quality center that most will have closed due to COVID-19 and will be unable to reopen because they were just operating on much too thin of margins. We treat early care centers essentially as small businesses in the state, while K-12 education is seen as a public good. But research shows that the quality of one, again, goes hand in hand with the outcomes of the other. Half of all childcare providers statewide have reported closures due to COVID-19. Whether they're afforded sufficient relief funding to allow them all to reopen will impact not only parents' ability to return to work, but student performance, particularly in reading proficiency, for years to come. So this is an equity issue to watch and to advocate around, because if we see some areas of the state where additional funding is made available and some areas of the state where it isn't, or if it's not made available anywhere, right? We know that the places where residents have lower incomes before COVID are more likely to have childcare centers that don't open, which means that they're more likely to have children who struggle with reading comprehension by the time they get to third grade. And also that they're more likely to have more parents remaining unemployed because they can't afford to go back to work without somewhere for children to go during the day. Like family economic security, education is tightly intertwined with health. So success in school and the number of years of schooling positively impact health across children's lifespan as well. More than 2 out of 5 children in North Carolina do not read at grade level at the end of third grade. And again, there are persistent racial disparities in both third grade reading and high school graduation rates across the state. National research indicates that chronic absenteeism is likely contributing here, though new data hasn't been reported by the U.S. Department of Education's Office of Civil Rights since 2015-16. That source, which brought the findings that you see on this slide, defined chronic absence as missing 15 or more school days. Using that metric, in the most recent data year that they have, 11% of elementary school students in North Carolina were chronically absent. I know that you all recently adopted a new definition of school days missed for the purposes of collecting this metric, and that should come out to about 18 school days in an average year, that 10%. But this is another equity issue as we talk about reopening plans for schools and for childcare moving forward, because chronic absence is associated more with family circumstances, like a parent's work schedule, than any desire to keep children out of school in most cases. So I think it's important that we ask what we're doing to help families deal with the stressors in their lives, certainly now that COVID-19 is something that we are all continually having to operate under, and also what we can do to ensure that children can remain in class. What can we do for families to make that possible? For reference, here are the counties with the highest and lowest rates of third grade reading proficiency. Remember that the statewide average is about 57%. Now moving on to physical and behavioral health. Health insurance is a big driver of poverty and also critically important to public health during the pandemic period. The rate of children with no health insurance is at 5% statewide, or 130,000 children who lack health coverage. At the county level, this ranges from a low end of 3% of children in Gates County who are lacking insurance to a high end of 19% of children in Graham County. The counties listed here are those with the highest rates of children without health insurance. These are double-digit figures where the ideal that we would really want to see is 0. As with most of the indicators of children's well-being, At NC Child, we do expect this one to get worse over the pandemic period and into recovery. In the last few weeks, hundreds of thousands of North Carolina families have lost the health insurance that they previously received through their jobs. Research tells us that children are more likely to be insured and to go to well child visits regularly when their parents are insured, which I think makes, pretty logical sense. But the opposite is also true. Because so many people have lost their health insurance recently and North Carolina has not expanded income eligibility for the Medicaid program, we're going to see a lot of newly uninsured adults and likely a lot of uninsured children as well. This is very problematic because children need regular preventative care throughout childhood to ensure they're developmentally on track. We've also already been hearing reports that well child visits and immunizations have been dropping significantly since the COVID-19 pandemic began. This is really troubling because North Carolina was already experiencing a decrease in vaccination rates statewide. That means that many children are not getting the vaccines and developmental screenings that they need to stay healthy. And while this can have painful and expensive personal consequences, it's also potentially disastrous for public health. We are just not well equipped as a state to handle a second wave of the coronavirus this winter, as well as a massive outbreak of measles. Now, with all of the figures that you've already seen and all of these varying factors impacting children's well-being and their environments in mind, I want to shift focus a little bit and talk a little bit more about a rising concern that NC Child and the North Carolina Institute of Medicine highlighted in the most recent Child Health Report Card, which is youth suicide. Suicide is rising as a leading cause of death for children and adolescents, and it's now the second leading cause of death for North Carolina's children ages 10 to 17. Despite this really worrying trend, significant barriers remain for many children who need access to mental health services. Thoughts of suicide, suicide attempts are more common among children who experience mental health issues like anxiety and depression, but mental health is only one of a variety of factors that impact youth suicide. Other factors are listed here. I've mentioned the brain development of young children a couple of times today, but adolescent brains are also continually developing. At ages 10 through 17, they don't yet have the impulse control of adults, and strong feelings may seem more insurmountable and more urgent, increasing children's risk of dying by suicide. Lethal means of self-harm also play a big role. 41% of child deaths by suicide in 2017 were the result of firearm use, which is completely preventable by storing guns securely or completely removing them from children's environments. I'll go into some other factors more on the next slide. So risk factors for youth suicide can include everything you see on the screen, as well as the social discrimination based on gender, sexual orientation, and race that a child may experience. Black students are more than twice as likely as white students in North Carolina to report having attempted suicide in the past year. And while 16% of high school students in 2017 reported seriously considering suicide, this figure included 12% of heterosexual students and a staggering 43% of gay, lesbian, or bisexual students. The influence of caring and well-trained adults, combined with evidence-based solutions that reduce family and community stressors, can prevent dangerous feelings of hopelessness in children and adults. Effective strategies include strengthening our crisis response system, increased investment in behavioral health systems, more partnerships between schools and behavioral health providers, and screening more children and youth for mental health needs. By pursuing these solutions, stakeholders can promote a healthier, stronger North Carolina and really keep our children safe. So I've summarized a few recommendations that I have for you all based on this data and also based on your most recent strategic plan. So the first is to require disaggregated data by both geography and by race whenever that is possible. Statewide and population level data can really effectively mask disparities in child well-being at the local level and particularly by race. It's important that you measure progress in moving the plan forward by indicators that are fully disaggregated so that you all will be able to tell whether you're actually moving the needle for all children. Secondly, children's behavioral health is going to be very important to monitor moving forward. You should start planning how to support students socially as well as academically because they rely on the school environment for both forms of support. There are bills moving right now regarding the availability of school nurses and psychologists and suicide risk training. You should consider whether you'd like to show support for those efforts and how to prepare schools for changes if those do pass. Reduced social support and no school-based learning are really important barriers for kids right now as we remain under shelter-in-place orders. And until those are fully lifted, a lot of children are also going to be living in households where there are stressors and trauma that's affecting them, and that they are unable to see those mandated reporters who can help to point them into the direction of really needed services, which also ties into, again, the availability and affordability of healthcare in the state. So thinking more about what we can do to make different healthcare supports available to students and families so that kids are less likely to be living in these high stress situations and coming to school carrying those burdens. And then finally, I recommend that you develop a plan for providing long-term food assistance partnerships in particular. Families are more reliant than ever on local schools as feeding sites through the pandemic, and we know that food insecurity was a massive problem statewide even before COVID-19 struck. If there isn't a resurgence of coronavirus, how will the school system transition from a essential, basically a service provider role for families to a more referral-based role? Is there more that you can do to connect parents to food and other resources that will ensure children show up ready to learn? I think now is a good time to really be thinking about that. And now finally, I just leave you with this quote from the U.S. Select Panel for the Promotion of Child Health, that children are 1/3 of our population and all of our future. So I just challenge you to think big when it comes to how we can support kids, and to remember that we will all see the result of our investments in children, and that our society really depends on our courage and willingness to move forward the things that the data show us the kids need right now, even if it's something that we've never done before. And if we have time, I'm willing to take questions now if everyone's ready.
So thank you, Ms. Tucker, for that very comprehensive, robust, and I should say sobering analysis of the condition of our children right now. I have no doubt that it will serve us as we prepare responses both in the wake of COVID and for long-term fulfillment of our 5-year window of this strategic plan. Mr. Chair, I know time is at a premium right now, but if it's all right to entertain a few questions, I'd like to do so.
Absolutely.
Mr. Ford.
Yes, sir, Mr. Hall.
Thank you, sir. And Ms. Tucker, I want to thank both of you so much for this presentation. It's eye-opening. It's not new. Some of it has been around with us for years, but it's certainly bringing to the forefront as issues that children of color have to deal with. My question is this. Is the presentation today in a booklet form, or how can one get a copy of it? Because I'm suggesting or recommending, Mr. Chairman, that we some kind of way send this information to every superintendent in this state along with the board chair. It is critical that all of us understand the need for children. The suicide rate, it's just strong. I just couldn't believe it. And the food issue, the absenteeism, I just think it needs to be broadly disseminated. And again, I want to thank you, Mr. Ford, and Ms. Tucker for bringing it to my attention once again. And yeah, that quote from 1981, I can remember using that. They are truly a small percentage of the population, but they are 100% of our future. Again, thank you so much.
Thank you for that. I have provided a PDF of the slides to Dr. Townsend Smith, and I'm happy for you all to share. And we also, as I mentioned, have our county level data cards and the Child Health Report Card, and I can provide links to both of those as well if you'd like to share these materials more broadly.
I thank you for that.
Ms. Tucker, for those listening, could you perhaps tell the audience where to get the publicly available cards from, the exact location?
Yes, so ncchild.org is where you'll find it. You could get to them directly by going to ncchild.org/data cards. And you can look at the North Carolina card and then also one specific to your county. And my contact information is also on each of those cards if there are additional questions as folks look through their county data and maybe want to know more about a certain issue.
Thank you for that. Thank you, Mr. Hall.
Thank you.
Pleasure. Board members, any other questions or comments? Okay. Hearing none, again, Ms. Tucker, thank you so much for your time, for your expertise, and for your willingness to speak to and put your finger directly on the pulse of our condition as a state, and particularly for, I would argue, our most important population with respect to all adults, and that is the children who, as you mentioned, are 100% of our future. Thank you so much for that. Mr. Chair, that concludes the presentation and report from the Strategic Planning Committee.
Excellent.
Thank you for having me.
Well, thank you. Thank you, Ms. Tucker, and thank you, Mr. Ford. I think Mr. Hall makes a great suggestion, not only for us to across the state to look at this information about the children in the communities and counties that we live in, but in the spirit of the way we started this meeting about caring for others, it's maybe even more important to consider reviewing this information to have a better understanding of the circumstances of children who live in other counties in our state that are unlike the ones we live in order to see how we have the opportunity to work together for all children. So, Mr. Ford, we look forward to further progress on turning our strategic plan into action, which I know is a major goal of yours and Ms. Kamnitz, as well as the whole board's, and there's even more critical in the face of COVID-19 and our recent national issues. I now recognize Ms. White, Chair of the Education, Innovation, and Charter Schools Committee. Ms. White.
Thank you, Chair Davis. Good afternoon, everyone. My name is Amy White. I have the pleasure of serving as the Education, Innovation, and Charter School Committee Chair, along with Ms. Jill Kamnitz. We have several items for discussion today. 2 items for action on first read, the first of which is EICS 1. This is a request from Grandfather Academy asking to relinquish its charter. Dave Machado is going to walk us through the particulars of this, but board members, basically this is a charter school in Banner Elk who was created in 2002 to meet the needs of a residential treatment program called the Grandfather Home. And the school only has 5 students enrolled, and based on some changes there, the nonprofit board is asking that it relinquish its charter. Dave Machado, would you like to provide additional information to supplement this material?
Okay. Yes, thank you, Ms. White. You did describe the situation correctly. This is a charter school that converted from a private school to a charter school in 2002. It's been serving students not only in Avery County through their children's home, but other LEAs in the western part of North Carolina. They serve students that were in abusive situations. Their enrollment has continued to drop. We were in discussions with them about applying to become an alternative school, but their board decided because of their low enrollment that the best thing was for them to close. So they want to close at the end of this academic school year, June of 2020. And our office has already started the closure procedure, which includes FBS, EC department, and we're gathering that data right now and making sure the records of these students do go back to the LEA that they'll be going to.
Thank you, Mr. Machado, for providing that additional information. Board members, what questions do you have about this particular request for relinquishment? Okay, seeing and hearing none, Our next item is EICS 2. This is a request from Kaleidoscope Charter to have a second year of delay in opening. Kaleidoscope is a charter school that was originally approved for a charter school in Wake County. It was approved to open in 2019. We already granted them a 1-year delay. They provided materials to the Charter School Advisory Board, and that board has voted to deny the second request for a 1-year delay. Mr. Machado, would you bring us the particulars of this particular school's request for their delay?
Sure. This is, again, a charter school that was supposed to open in 2019. It was going to serve grades 9 through 12. It was going to be in the Morrisville area of Wake County. Their entire application was based on the fact that there was no high school in Morrisville. Our office was able to grant them a 1-year delay last year. They came before CSAB asking for a second-year delay. They have really had difficulty finding a facility. That's been one of the main reasons for the delay. And their projected enrollment wasn't where CSAB felt like it needed to be. And CSAB felt, the Charter School Advisory Board felt like they had had enough time to get their enrollment situation and their facility situation further along, so they denied the request and are making the recommendation to the State Board of Ed that they not be granted a second-year delay. And you'll notice when we get into the RTO discussion that they are in the RTO discussion, and as we will talk about in that discussion, that they will have to come before the advisory board next Monday to give a update of where they are and are they able to open up this year, and then CSAB will make a recommendation to the state board on that in their July meeting.
And Mr. Machado, just for those listening who may not know all of the acronyms, RTO stands for Ready to Open.
Yeah, excuse me, Ready to Open Planning Year, yes.
Yes, sir. I swam in those acronyms the first 2 years on the board. I still don't claim to have it straight. Board members, questions about Kaleidoscope? Okay, okie dokie then. So just to make it clear, upon the discussion from Ms. Kamnitz and from me, we are going to uphold the CSAB's denial of the request for the second year delay. So when we get to the voting part, the vote will be to not approve the second year of delay. Anybody have questions about that particular recommendation? Okay, let's move to action then. EICS is a request from Virtual Academy, NC Virtual Academy, to maintain the enrollment above the statutory maximum. Board members, as background, you will remember that the General Assembly in session law extended the 4-year pilot program for the state's virtual schools an additional 4 years, and this school was before us last year to ask for an extension of their enrollment cap, which we granted. They are asking that maximum student enrollment threshold be maintained for a second year. And so again, Mr. Machado, I'll ask for you to provide any additional details. Board members, I also will turn you towards the email, if you did not have time to read it, that came from the new head of school, Lauren Acom, explaining her advocacy about NCVA's request. Mr. Machado.
Thank you. As Ms. White stated, they are currently in their 5th year of their 8-year pilot program. North Carolina General Assembly statute says that their maximum enrollment should be no more than 2,592 students. Statute does give State Board of Ed the ability to increase that enrollment, and they are asking that their enrollment be allowed to stay at what it was last year, which is 2,945 students. You did approve that last year. Charter School Advisory Board unanimously approved this recommendation. And just a little background, NCVA currently has right at 2,700 students. They have 3,100 applications for only 403 seats, and they have no seats available for high school and third grade. So the demand is definitely there with the movement to remote learning. I think CSAB in our office saw the need to ask for this request.
Thank you, Mr. Machado. I'll turn to my colleagues to give you the opportunity to ask any additional questions.
Ms. White,
Yes.
this is Alan
Mr.
Duncan.
Yes, sir, Mr. Duncan.
So this is more a comment than a question, I think. I believe the school is engaging in significant improvement from where they were a year ago. I think it was my position a year ago, and really remains, that before we expand enrollments, we should have a proven record of success for school. And I did not think, based on both the grade level assigned and, more importantly, the growth data that was in that position. I did look at the interim information that was provided, which was helpful. And I believe that the new headmaster is somebody who's very committed to the improvement of the school. So I think that it's on a much more positive course than I felt where it was last year when we had that vote. So it's a harder vote for me, and what makes it particularly difficult is we don't really have any good criteria/information about this present school year, other than the interim data. We don't have the traditional data to try to analyze some of the factors that are important to try to come out with a decision on the levels of improvement that are being achieved. I do think that this headmistress is very committed, and I think there are signs of change. But I will say it's still a struggle for me to vote for it. I realize there's a demand for virtual charter schools, but we equally have a requirement to make sure that they're serving the best interest of students. And so it's much harder thought for me this year in terms of where it is, but this is not an easy decision. I'm just explaining. I'm struggling with it and why. Although I have some optimism that in the future I won't have to struggle with it, and I hope believe that's likely to be the case long term, and hope it is. Thank you for giving me a moment.
Thank you, Vice Chair Duncan. I believe I saw Mr. Buxton unmuted himself.
Good eyes, Ms. White. Thank you. I just want to make sure I understand the numbers. Last year, we went from 2,592 student cap and agreed to a 2,945 student cap. And so if we don't approve this, then that means the school goes back to a 2,592 student cap. That's my first question, just to make sure I've got that right.
Yes, that is correct.
Okay, and then there are currently 2,700 students there. So is the issue that they didn't grow to the full enrollment cap that we had granted, or is it that going into next year, that's how many students returned out of the 29 and changed?
The biggest reason that they are not at that 2945 right now was last year, after they were granted the increase by the state board, their particular board decided instead of growing by 20%, that they would only grow by 10%, so they could put even more emphasis on academic growth. So that was an internal decision. So the 2,700 was still more than the 2,592 that they were capped at.
Okay, and so just to follow up, Madam Chair, if I could.
Yes, sir. Go ahead, Mr. Buxton.
And so is it correct that agreeing to the 2945 would essentially allow them to grow an additional 245 students this year, but not agreeing to it would cause them to have to tell something in the neighborhood of 150 to 200 kids that they've got to de-enroll or whatever, unenroll.
Yes, sir, that is the way we understand it.
Okay. Thank you, Ms. White.
Thank you, Mr. Buxton. Colleagues, what other questions do you have?
Can I ask a question? This is
Follow.
Alan Duncan again.
Chair Duncan?
Yeah.
Yes, sir.
Following Mr. Buxton's questions, does the board have as an alternative a middle ground in which it would allow a 10% increase this year, which would then hopefully cover, or would seem to cover anyway, all the students who have been there, so they would not have to unenroll, if you will, but we're not opening it up yet to a broader enrollment until we see the level of progress that we all hope and want to see and believe might happen. Is that even something that's an available option is the question.
Mr. Vice Chair, this is Mrs. White again. Certainly, if that's the board's decision, it is at our discretion to come up with a middle ground. What I'd tell you is we have a provider specifically equipped to deliver onlining through a platform. I would say it is better equipped for instructional delivery at this stage in the game than most of the rest of the schools across our state who were thrust into offering remote learning for its students. And so I don't have a pause about offering them the opportunity to move up to the 2,945 students that we granted last year, but I'm not inclined to offer any more until we can get our hands on some data. So that would be my position on it. But the board absolutely has the opportunity to make its decision collectively.
Ms. Chair?
Yes, Mr. Keenan.
Yes, I definitely agree with what Alan said. I thought about it, and I understand there's be a need for more remoteness, but I'm just not totally convinced that that's the answer, just to put them there. But I do have some problem with it. So right now, I'm definitely on the same position that Mr. Duncan is.
So what would be your, this is Mrs. White again, what would be your answer for telling those 150 students who were previously enrolled and pleased with the instructional delivery that they cannot re-enroll for the coming year?
Well, my answer, somebody's going to say something? I'm just hoping you can find some type of compromise, as mentioned by Mr. Duncan, but to me, the data speaks for itself. Sometimes people think they're doing well, but not necessarily well that you could be doing. So I guess the answer to your question is, it depends on your interpretation of how well you're doing.
Okay.
That's my response.
Sure. Mr. Buxton, did I see you with your hand raised again?
If it is, that's unintentional. Let me mute. So
Okay. Colleagues, any other folks that want to weigh in on this?
Ms. White.
Yes, Mr. Bristow-Smith.
I often do not weigh in on issues related to charter schools because I don't see that as an area of expertise that I have. However, I do think that it's important as we're thinking about remote learning and the challenges that we may face in the coming year to look at this issue from the perspective of children. And if we have children that are already being served in a school environment, whatever that might be, charter, traditional, private, homeschool, whatever, to thrust them into a different school setting while we're also potentially going to be moving into remote learning at no fault of their own. Does not hold them harmless in the same way that other board policies we've tried to craft during this period of time have made a similar effort to hold children harmless for situations that are outside of their control. I just wanted to make that observation in this dialogue. Thank you.
Thank you so much, Mr. Bristow Smith, for those thoughtful comments. Anyone else?
Mr. White, it's Mr. Buxton again. I'm sorry, JB.
Yes, sir.
I think what Mr. Bristow Smith, Mr. Duncan, and Mr. Keenan are all saying are things I agree with, which is I would not want to tell students enrolled at the school that we're moving backwards on the enrollment we had agreed to previously. And so that, I think, is 2,700. I guess what I'm trying to struggle with is opening up additional seats at this time. I did hear your commentary on that, and I appreciate that. But the 2,700 number seems to me to be a decision we could make, to Mr. Bristow Smith's comment, with children in mind who have made that and having some academic continuity in place. So I would hope that whatever we do, we at least can maintain that commitment to a choice that they've made with our permission, if you will, from last time.
Thank you, Mr. Buxton. I guess I'm struggling with, in the context of using data to make sound decisions. We did make a decision last year to offer them the opportunity to have more seats. And you're right, we don't have any new data that suggests the validity of the programming that were offered or poor academic performance on what was offered. And so I struggle with taking away something that we previously voted upon, given the current COVID-19 situation and the idea that students may be moving in and out of the traditional classroom setting, and this is a platform where students have purposely chosen to engage in online learning for the entire year. Parents that are purposely exercising their choice to engage in online learning throughout the year. Not students who were thrust out of the traditional classroom and are suddenly scrambling. I think that's part of the reason for maybe some of the uptick in demand, but for the large part, the demand was there before COVID-19 ever became a pandemic.
Ms. White, I did talk to the school about what do they attribute the large number of interests and applications in their school, and they said that when they were talking to these families, the hesitant of going back into a brick and mortar school really did concern the parents, and this was a choice that these parents wanted to have, and that's why the uptick in interest is there. So I agree with what you said earlier, Ms. White, that of all the remote learning that's going on in the state, I do believe that North Carolina Virtual Academy is probably best equipped to educate these new students that do want to come into their school. I think the parents are talking and voting with their feet by wanting to go into this school. So I would like to, obviously we support the request to move up to the 2945 that you granted last year also.
Ms. White, this is Olivia.
Yes, ma'am, Dr. Oxendine.
Thank you, Ms. White. I've listened for the last 5 or 6 minutes to very good reasoning in both directions. And I come down, I suppose I'm going to vote on the basis of, in general, in this environment of COVID-19, and we can all write long books about it. I vote to support this decision simply because I am so opposed to anything that's going to be disruptive in the education of the student, and most certainly in maintaining, I mean, things are so fragile in the physical, emotional well-being of kids these days and adults. So in the spirit of not bringing any further disruption in the lives of students, and I would venture to say that I surely don't have data in front of me. I'm operating on intuition when I say we probably are going to hear from parents whose kids have been formerly in our brick and mortar settings that will want to do something remotely going forward. So I'm in favor of this request. Thank you.
Thank you, Dr. Oxendine. Any last comments before we move on to our discussion items?
Yeah, Ms. White, I would just like to add that I also am in support of the CSEP recommendation. I think, as Olivia just said, we're in extraordinary times, and it requires some out-of-the-box thinking and flexibility on our part. Mr. Bristow Smith made a good point, I think, about the importance of this option for many families. And, you know, we may be looking at a situation where parents are choosing between sending their children to a brick and mortar school that they are uncomfortable with safety-wise and homeschooling them. And so these seats in this school offer an opportunity for those children to have experienced instruction. And I think that we should support the CSEP decision.
Thank you, Kamnitz. Okay, any other comments? Okay, this item will be before us tomorrow for action. Let's move to discussion, and EICS 4 is the preliminary 2020 charter school ready to open recommendations. These are schools which have been reviewed by the Charter School Advisory Committee and are pending further evaluation at the Charter School Advisory Board June meeting, which will be held Monday of next week. And that final declaration will be whether or not they are ready to open for the fall of 2020. Mr. Machado, I'll turn it over to you to walk us through the particulars.
Okay. There were 14 schools that started the ready to open / planning year, and 5 have asked for a 1-year delay. So you are seeing the 9 that are scheduled to open this fall. Charter School Advisory Board is going to make their final recommendation on Monday at their advisory board meeting of which ones they are going to recommend to State Board of Ed to open. We wanted to bring this slate to you today so you could see the schools that are under consideration, and for the July meeting, it would not have been action on first read. There are 4 schools that are coming back to the Charter School Advisory Board on Monday, coming back remotely to discuss their situation, either what their enrollment numbers are at this point and or what is their facility situation. And there are 4 schools on this list that will need to have better data on Monday to get recommended to you in July. And those 4 schools are Achievement Charter in Harnett County, Elaine Riddick Charter, Kaleidoscope Charter, and Wilmington School of the Arts. Those 4 schools are coming back to address their situations with the Charter School Advisory Board. So at your July meeting, we will be giving you the most updated list of schools that are being recommended to open. And it could be all of these 9 or possibly 5 of the 9.
Thank you, Mr. Machado, and a special thank you to you and your team as you collect, collate, and disperse materials about these schools and their applications to the members who give their time on the Charter School Advisory Board for our state. And it's those individuals who take the time to use that information to interview the schools to determine through a very rigorous evaluation process about whether or not they are ready for students at the time that they'll open. So thank you for that, for the work of your team. We will look forward to hearing what they have to say after their Monday meeting. Board members, do you have questions or concerns about any of the schools as they appear on the list as it appears today? Okay, silence from the masses. So thank you. I'll, if you do, colleagues, if you will reach out to Mr. Machado with any questions that you might have in order to be prepared for us to review information and make a vote at the July meeting. So let's turn to EICS 5. This is a request from Three River Academy to relocate and to remove the growth stipulation that we had placed upon them back in the fall. If you'll remember, we did back in November, friends, we had a conversation about them possibly relocating Three Rivers from Windsor in its current location to, well, from Powellsville to Windsor, and now they're asking to relocate back to the original school location in Windsor. I'll be quiet. Mr. Machado, will you please take over?
Yeah. Yes, ma'am. Just to, Three Rivers is requesting to relocate back from Powellsville to Windsor. And if you remember, Three Rivers is a school that assumed Heritage Collegiate Leadership Academy several years ago. They are in their second year of operation as Three Rivers. This move is more than 5 miles back, 5 miles, so State Board has to approve that. The reason for the request is they feel like Windsor is more centrally located in Bertie County, and they're able to have a more favorable lease and purchase the facility that they're going to be moving into. The school knows that they cannot move into this building until they get an educational certificate of occupancy. They wanted to get this approval from the State Board to go ahead and put the money into the building to do the final repairs that need to be done. And they wanted to do that when they got the approval from you, so they would not be spending this money in vain. And again, you had put a stipulation on that they met growth or exceeded growth this year with no data available. Charter School Advisory Board felt like it was appropriate to take that stipulation off. And discussions in our office and discussion with Ms. White and Ms. Canvas, there was some discussion of maybe moving that stipulation to the following year and not totally take it off, but that is a discussion for the State Board to have.
Okay, thank you so much, Mr. Machado. Questions, board members, about Three River Academy's request to move back to its original location?
Do we know what the enrollment situation is at this point?
They, Mr. Duncan, they started school with 85 students, and they ended school with just under 80. That is one of the reasons they feel like they wanted to move, but their enrollment has been staying right about that 80 mark.
Mr. Machado, you may be able to help me. Are there some stipulated requirements for what the minimum number of attendees for the school should be?
General Assembly statute says that a charter school should have no less than 80 students to stay open.
And you feel at the end of the year you think it was 80 or it was 80 or above? That's information you have?
It was just under 80. I think it was 78. I think that's the number. The number that the Charter School Advisory Board and our office goes by is what is their 20-day ADM. And it was above 80 at that time. And if they don't decrease by more than, I think it's 10%, then we no doubt recommend that they close. So they were right there at the statutory minimum throughout the year.
All right, thank you for that information.
Mr. Buxton? No, okay. Let me add in that another portion of this request is that they are asking that the stipulation that was placed upon them about meeting or exceeding growth be removed, and the sort of inclination or the suggestion on that is that it be removed permanently, and I am struggling with that. This particular school has been through a lot of strife in the last year, but I don't feel like that we can relinquish our demands that it absolutely put the hammer down on meeting or exceeding growth for these students. Location, I would not be in favor of removing that stipulation.
Ms. White, I would not be in favor either. This is Ms. Kamnitz.
Thank you, Ms. Kamnitz. Questions about that or any uncertainty about that? Any other general questions about Three River Academy's request at this time? Okay.
Can I ask a separate question, and that goes to the number of students?
Absolutely.
Is there any stipulation that could be imposed? I mean, I realize one of the things they're asking to do, and I certainly understand why they would do that, is they don't want to invest in facility without having some indication as to what the view of the board would be about their willingness to allow them to relocate. But at the same time, is there an ability to provide a stipulation that you have to have a certain number of students before not just I agree with your comments about the other stipulation, but some stipulation with respect to the number of students. Since they ended the year, it appears maybe a little below what's statutorily required. I mean, we have to have some concerns in that direction as well.
Agreed. Mr. Machado, would you like to address the again about the 80 student mark?
Right. It is statutorily, it is required at a charter school, to have a enrollment of 80 students at the after their 20-day count. I think it, in my personal opinion, a stipulation that says that they must open up with 80 or whatever number that you're comfortable with, I think that would be appropriate. Again, that would be your decision, obviously, but we would certainly be in favor of that being a stipulation.
Other comments? Okay. Vice Chair Duncan, that's certainly something that we could include in the amendment. Board members without objection, if you'd like to see Three Rivers reopen with at least 80 students, then we could certainly include that in the recommendation. Okay.
So just to be clear, we would be re-including, we would not be removing the growth stipulation, and we would be putting a numerical requirement for 80 students to open. Is that what we're saying?
I think, in consultation with Mr. Machado and perhaps with legal, we can make sure that we have our wording correct. But I think what I'm hearing from several of us is that we want to make sure that if we approve the request, that we would add a stipulation that requires numeric value to the number of students enrolled in the school by the 20th day. And then we would not remove the growth stipulation. So that growth stipulation would also remain in place. But we would grant them, the recommendation would be that we allow them to move back to the original location, which is in their original argument. They're thinking that their number, because of proximity and location, that their numbers will increase. When they moved to Powellsville, it was about 20 miles away from their original location, and as a result of that, they lost a number of families. Mr. Machado, am I remembering that correctly?
Yeah, Powellsville, I think was, yes, 19 to 20 miles away from Windsor, and they wanted to move. The reasoning to move to there was they could not negotiate a good lease at the current location, so they decided to move further away. They realized that was not centrally located. They did lose a lot of students, and they haven't in turn been able to negotiate a better lease and to possibly purchase the building that they will be moving into.
Could I ask him one more question just to clarify the consequences of an opening number? Well, if a school doesn't meet the 80 threshold on the threshold of 80 students on the 20th day, what happens then? And the school doesn't close.
We've had several situations, Ms. Camden, where we actually closed the school.
We have.
Yes, and then we've had a situation this year where we had two schools that were below that, but had the finances to make it through the whole year. So they were allowed to stay open and were put on financial non-compliance and had to come before CSAB every quarter.
Food for thought then.
Yes,
Yes.
it has, yes.
Ms. White, I have a quick question.
Yes, Dr. Oxendine.
This is Olivia. Thank you very much. When we talk about a charter school and its facility, in this case, a charter school that's requesting to return to an original site, does that request also include more than the facility? Are we looking at campus space as well? Acreage?
This request, there is a fairly large building, and I've been there several times. I'm going to say it sits on about 4 or 5 acres. That's a description of that property, and they're retrofitting the building, and it has it's an old Wrangler factory is what it is.
So it's really property rather than facility. It's all of the facility and the, I suppose, acreage, campus space, and what have you.
Yes, ma'am. Yes. Yes.
Because we could get into some dicey situations. Just curious. Thank you.
Well, let's see, two points here. This is Mrs. White again. One is in the language presented in the executive summary, the request is contingent upon receipt of the educational certificate of occupancy. So the building and the grounds would need to be deemed appropriate and ready for students. And then the second thing that gives me pause to my earlier comments, sometimes I speak without thinking, and forgive me for that, but in light of this request is for this upcoming school year, and in light of the COVID-19 crisis, the uncertainty about getting schools ready to open and having students back open, I hesitate to put a number, attach a number contingency that is different than the 80 that's required by law, because we just do not know what school will look like when August comes. And so I have trepidation about, for this particular school, putting a number, given that we just don't know what the parameters will be for on-site learning in the fall. Okay. No comments on that. Let's,
How about a question?
okay.
A question on that.
Yes.
The statute says 80, and I appreciate your point about there's uncertainty obviously around where we are for the next school year. If whatever set of circumstances it doesn't meet 80, whether we make that stipulation or not, is the school still positioned to go forward? I'm assuming other charter schools, for example, will have over 80 and will have, if there's an inability to actually attend in school, will have some form of, whatever their form may be, of remote learning going on. If this school's not able to get 80 with either the ability to be on campus or alternatively some form of remote learning, will they even qualify under the statute? I guess is what I'm still struggling with a little bit. And I agree with you that the sense that it's not an easy year for this, which I think was the gist of your comment. But I'll be quiet now. But I don't think we can. Do we even have the authority to just waive the 80 requirement? It doesn't seem like we do if it's statutory.
I'm not suggesting that we waive it. I'm suggesting that in light of the comments about the concern of the totality of student population, that we not tinker with the statute which says 80 and the number that's articulated in the charter agreement, and that that they would fall into non-compliant statutorily and with their agreement if they fall below 80. But to add any additional numbers on top of that, or an additional number stipulation, would not be appropriate at this time given the current pandemic crisis that we're facing. So in summary, my suggestion would be that when we come back in July, this is a discussion item, when we come back in July to vote on this particular item, that it would be to approve the Three River Academy request to relocate, but not to approve the request to remove the growth stipulation. But we do have time for another couple of weeks of discussion before we tackle this at our July meeting. So I would encourage, in the interest of time, that if any new ideas come to light, that we direct those to Dave Machado and his team at the Office of Charter Schools. Okay, let's move to our consent items. There are 2 of those on our agenda today. We'll be voting upon tomorrow. We have a request from Moore County there were 3 schools that have submitted their restart applications. As mentioned in the last discussion, we're so excited about leadership coming from Ms. Mariah Morris as she takes a role there, joining that already effective team in Moore County, but the leadership that she'll provide for some of their low-performing schools. Anybody have a question about Moore County? Okay, the next consent item is EICS 7. This is a request from Willow Oak Montessori to relocate. Is there any discussion about that particular request? Just as a little bit of further information, it is still within the same county. It is about 9 miles away, and but still within proximity, and it's basically in the Chapel Hill area. And then finally, EICS 8, Bradford Prep Schools request to implement a weighted lottery. This is yet another one of our schools that's made a very positive decision to increase diversity in their school by using that lottery. And so it's before us for approval. Any questions about Bradford Prep's request. Okay, Mr. Chair, this concludes the report of the Education, Innovation, and Charter School Committee. I turn it back over to you.
Thank you, Ms. White. That concludes today's committee work. We will have two more committee to work tomorrow during our board meeting, which will begin promptly at 9 a.m. I want to thank my board colleagues, advisors, DPI staff, and others who contributed to today's meeting. I now ask for a motion to go into closed session, and note for the audience and online listeners that following closed session, the June 3rd, 2020 meeting will adjourn immediately. Vice Chair Duncan.
I move that we go into closed session to prevent the disclosure of privileged information under NC General Statute Section 147-64.6D and North Carolina General Statute Section 115C13. Also, to consult with our attorney in order to maintain the attorney-client privilege and to consider and give instructions concerning a potential or actual claim, administrative procedure, or judicial action in Polk County Board of Education et al. Versus State and Amplify Education Inc. versus North Carolina Department of Public Instruction et al. And Kinetic Minds versus Department of Public Instruction. And finally, to consider the qualifications, competence, performance, or condition of appointment of a public officer or employee, prospective public officer or employee.
Motion by Mr. Duncan. Is there a second?
Ms. Kamnitz.
Second by Ms. Kamnitz. Dr. Townsend Smith, will you call the roll to capture the vote?
Yes, sir. Mr. Buxton?
Yes.
Dr. Oxendine? Dr. Oxendine?
Yes.
Thank you. Ms. Kamnitz? Ms. Kamnitz?
Yes.
Mr. Keenan? Mr. Keenan? Mr. Hall?
Yes.
Dr. Tipton Rogers?
Yes.
Ms. White?
Yes.
Mr. Chastain? Mr. Ford?
Yes.
Vice Chair Duncan?
Yes.
Chair Davis?
Yes.
It is unanimous.
Okay, motion carries. Let's take a 10-minute break, and then we'll go into closed session. So everyone except board members will need to drop off the line. So 10 minutes, say 2:50. We'll be back in closed session.